Okay, we are live. Good evening, everyone. Today's session is going to be really helpful and it's led by Dr. Joshita Naik from Apollo Cradle and Children's Hospital. She's going to talk about does vitamin D deficiency during pregnancy impact your baby's health? So stick around until the end and ask us questions if you have any. Doctor, you have the stage.
Good evening, everyone. So today we have an important topic for discussion. That is vitamin D really essential in pregnancy? Does it actually impact your baby's health? This is what I'm going to discuss today. So before going on to the actual topic, let's understand what is this vitamin D and from where do we get it. So vitamin D is an important hormone which is important for our bone mineralization, like all of you know. So it's important for the calcium metabolism in the body, which strengthens the bones. So, what are the sources for this vitamin D? So, basically, we have two important sources for vitamin D. One is the endogenous source, or the one that is produced within our body, and the second one is the exogenous source, or which we get from our diet. So, the endogenous source is the most important one, wherein vitamin D is synthesized in our body through our skin with the help of the cholesterol. So when we are exposed to the sun's radiation, basically the ultraviolet, the B radiation, that's when there is vitamin D synthesis. So there are multiple complex procedures which are involved, and various complex pathways through which this active form of vitamin D is generated. Coming on to the exogenous source, so where can we get vitamin D apart from the exposure to sunlight? So, vitamin D can be obtained from sources like fish, like salmon, egg yolks, certain varieties of mushrooms. But all these do generate certain amount of vitamin D, but they're not actually, as much as the daily requirement that is necessary for us. So, coming on to what are the risk factors that are associated with the vitamin D deficiency? Who can be more prone for vitamin D deficiency? So, basically, there can be vitamin D deficiency if there is less production of the vitamin D. That is basically seen in people who use sunscreens with an SPF of more than 30. This blocks the UVB radiation, which doesn't allow the vitamin D to be synthesized, or people with a darker skin tone wherein the melanin pigment is high. So these people need at least 3 to 5 times more exposure to sunlight than the ones with a lighter skin tone. So again, we belong as Indians. We have more melanin pigment in our skin, so we belong to the high risk group because of our ethnicity. So that is why we see that a lot of Indians are vitamin D deficient. If we screen a general population, we would see numbers as high as even about 80 to 85% of the Indians being vitamin D deficient because of our ethnicity and our darker skin tone. Then the other factors that could be are to do with decreased intake, where your diet is not very rich in these vitamin D rich foods, like you've been consuming more of a vegetarian diet which is restricted, less amount of fortified, because a lot of foods nowadays are fortified with vitamin D, especially milk, dairy. All these foods are generally fortified. The juices, all of these are usually fortified with vitamin D. Even the nutritional supplements and the external feeds that are given to babies are usually fortified with vitamin D. So, if there has not been an adequate intake with respect to either fortified foods or the natural sources as I had told earlier, then too there can be vitamin D deficiency. And the other risk factors would be obesity also increases the risk of vitamin D deficiency. So, what are the implications in pregnancy? So, a pregnant mother, when she is vitamin D deficient, then she can be more prone for certain inherent problems related to pregnancy, like hypertensive disorders in pregnancy, what we call as preeclampsia. There can also be increased association of gestational diabetes in pregnancy, and also these can have indirect implications on the baby's growth and the nutrition. The other important factors which can influence the outcomes in pregnancy are the mother may be prone for certain kind of infections, like what we call as bacterial vaginosis. She may be more prone for preterm deliveries because of these infections. So all these do have an implication on the baby's outcome. So what is the actual importance of maintaining these vitamin D levels in a normal form in pregnancy? So basically, the baby, like all of you all know, starts accumulating calcium. So there is about 2 to 3 milligram of calcium that is accumulated every day in the first trimester, and towards the end of the third trimester, it's about 4 to 6 milligrams per day. So for this calcium to get absorbed and to get accumulated, vitamin D is very, very essential. So it's important that the mother's nutrition contains adequate amount of vitamin D so that this process of calcium deposition and strengthening of the bones happens in utero or when the mother is pregnant. So this is important because all babies undergo what is called as a fetal programming when the baby is in utero. So it is called as the epigenetic programming, means all the genetic programming of the baby starts at the time of fertilization. Means when an embryo is formed, from then all the genetic programming happens, and this is influenced to a large extent by the environmental exposure that happens to the baby when the baby is in the mother's womb, and it is also influenced by the nutritional status of the mother. So this fetal programming, what we say, is very, very crucial because this is going to determine the baby's overall health, not only during the 9 months of pregnancy but also through the period of infancy and through childhood and adulthood. So this is an important concept that we need to understand, that the maternal nutrition is rightly corrected and is well balanced so that we are going to influence the baby through its entire lifespan. So for this reason, we look at correcting the nutritional deficiencies in a pregnant woman. So are there actual guidelines which recommend that routine screening of mothers should be done during pregnancy? Actually, no, there is no specific guideline which says that every pregnant lady who walks into the clinic should be screened for D deficiency. But with our kind of ethnicity, and as such, we belong to the high risk population. So if they say that there are two or more risk factors which are involved, like if the mother is obese, or she has underlying risk factors, or her diet is poor, or she is having other nutritional deficiencies, then yes, it may be worthwhile doing the vitamin D levels in pregnancy. So, what is the ideal vitamin D level that should be maintained? So, when we do our blood workups, routinely a lot of us do get regular health checks done as a part of our annual health check programs. So, and in most of these, the essential vitamins like vitamin D, B12 are all included. So it's important to understand, first of all, where you stand, and this is ideally done even before you conceive. So a preconceptional test of the vitamin D, ensuring that you're well corrected and in the normal range, really goes a long way to help maintain this level during pregnancy. So what are the ideal levels? Ideally would be around 30 to 70 nanogram per ml is what is the ideal recommendation for the vitamin D levels. If it's less than 30, then we call it as insufficiency, and if it's below 20, it's a deficiency. And if it's below 10, then it's a very severe deficiency. And below, when the values are below 10 in pregnant mothers, there can be an association of what we call as congenital rickets, or a real problem of the bone mineralization and skeletal deformities in the baby. So this is why it's essential to understand the vitamin D levels before, I would say ideally in the preconceptional phase or in the early phase of pregnancy, so that we are influencing the fetal programming early on in pregnancy. So if what is the ideal requirement of vitamin D, there are varied opinions on this. And vitamin D again is influenced largely by the absorption, like I described, that the endogenous source, or the one which we synthesize in our body, is more important than the exogenous source. And this endogenous source is largely influenced by the place that we live, that is basically the latitude, the season, and then the time of exposure to the sunlight. So all these are extremely difficult to understand as to, how would each individual respond, and how much vitamin D would be accumulated by that individual through the basic natural sources. So there have been studies which say that it's about 18 international units per centimeter square for about 3 hours of exposure to sunlight. But like I described, it again depends on many confounding variables like the skin tone, the time of exposure, the place where the person is getting exposed to the sunlight, and the season. So it is quite difficult to understand that what is the ideal requirement. So ideally, the Food and Nutrition Association says that it is about 400 international units per day, but in pregnancy the requirements do increase to about 1000 to 2000. So there are various bodies which have done various studies to understand what is the ideal requirement. So they have come to common consensus, like the American Society says about 2000 international units per day. But this is again influenced by the regional place. Like if a person is in a higher latitude where there is less amount of UVB radiation, then the requirement would be much more. So if a person is really severely deficient with vitamin D, then the requirement goes as high as even 4000 international units per day. So this is the importance of understanding the vitamin D deficiency, and understanding that what is the need for supplementing the vitamin D in pregnancy. So what could be the implications on the baby because of this vitamin D deficiency in the mother? So like I discussed, that the babies can be associated with congenital rickets, which is the most common concern, because we all know that vitamin D is important for the calcium absorption, which again influences the bone mineralization and the overall skeletal development of the baby. There can be association with delayed closure of the fontanelles. There can be association with low birth weight in these babies. These babies may be born early. There can be increased association with preterm delivery. So these babies are born much more earlier. And there are obviously problems related to preterm care of the newborn. There can apart from these, certain other associations are seen, like these babies may be more prone for allergies. So they may have recurrent bouts of lower respiratory tract infections during their infancy. They may be more prone for skin allergies or eczemas. Then these babies in the early period of infancy, or in the neonatal period, may present with fits or seizures related to low calcium levels, what we call as hypocalcemic seizures. So, and also in certain babies, when the condition of the vitamin D deficiency is very severe in the mother, sometimes it can even affect the baby's heart, wherein there can be poor functioning of the baby's heart, what we call as dilated cardiomyopathy. So it's not only to do with the bone mineralization and to do with the calcium levels that are important, it's also to do with all these other influences in the baby. And certain studies have also shown that these babies are also associated with increased risk of diabetes mellitus, or type 1 diabetes. So there are varied implications, which are again, there are not many studies, but yes, evidence is heading there, because we are understanding the importance of vitamin D supplementation for a pregnant mother. So in and this vitamin D levels in pregnancy are highly influenced by the pregnancy related hormones as well. So a lot of hormones that are secreted during pregnancy, like the prolactin and the estrogens and the human placental lactogen, do influence the vitamin D levels, and there are increased levels that we see in the third trimester. But these levels again normalize, or they go below normal, or they drop below normal during lactation. So in the first 6 to 8 weeks when a baby is born, the levels of the vitamin D are only maintained through the in utero transfer, or what was the placental transfer that had happened for the baby when the baby was in utero. after which is when the baby actually starts showing the levels of vitamin D which it receives through the supplements. So and when a baby is exclusively breastfed, then the levels of vitamin D may be very very poor in the baby, because breast milk contains actually very low amounts of vitamin D, contains only about 20 to 40 international units per liter. So that is like a really low amount. So most of you might have seen that as soon as the baby is born, when you're being discharged, the pediatrician says that do give these vitamin D drops to your baby. Either give it directly or give it with a little amount of breast milk. So this is the concept that the breast milk contains very low amounts of vitamin D, and the babies do require additional supplementation of vitamin D, especially when they are exclusively breastfed. So I would say that it's important that we understand the sequelae of the impact of vitamin D on the baby's health. And how do we prevent all these problems is by addressing the maternal nutrition. And when do we address it? Is it in pregnancy or is it before that? So I would say look at your vitamin D levels even before you plan conception, since as Indians with our ethnicity, we do belong to the high risk group. It may be worthwhile doing your vitamin D levels just to understand if you belong to the normal range or whether you're severely deficient in your vitamin D. Have a correction done before you plan pregnancy, and then go through the journey, because this little intervention is going to go a long way in influencing your baby's health. Thank you, one and all. I'm open for questions.